Good morning, everyone. Welcome to the Treat Your Neck Pain webinar. I'm excited to be hosting Dr. Nick Predtechensky from Onsight Chiropractic. And for those of you who don't know me, I'm Janet Thompson. I have an acupuncture and herbal medicine practice here in Oakland. And Nick, if you can pop us to our next slide. So I wanted to let you all know a little bit about what we'll be covering today. The bulk of it is really going to be the guided treatment section, but we wanted to start with a little bit of welcome and introductions. Dr. Nick is going to give us an overview of a little bit more information about neck pain. And then we'll talk about a whole suite of self-treatment options. Then we'll go into the guided treatment, which I'm guessing will be a good 30 minutes or so of time. So that's where we'll get the bulk of the techniques over to you. We'll talk about stress and your neck. We'll talk about ergonomic issues, and then we'll open it up for Q&A at the end. All right, let's go to the next one. So just a little bit of information about me so you know the perspective that I'm coming from. I'm based in Oakland, and I do treat both kids and adults. So I use a range of treatments. I use softer techniques on kids. I had someone in who was 11 years old on Friday with neck pain and used very minor techniques to get her pain to release and her muscle spasm to release. So I use a blend of acupuncture and acupressure. I used cupping, which is the Michael Phelps treatment for those of you who are familiar with cupping, gua sha, moxibustion, herbal medicine, and then lifestyle recommendations to support the treatments that we're doing. So that's my background and my focus. Dr. Nick, you're up next.
Hey, for those of you that don't know, I'm Dr. Nick. I'm a chiropractor over in a sports chiropractic practice in Berkeley. And even though we're a sports chiropractic practice, we treat everybody, families, grad students, kids, but we really take on the sports mindset. We really like to be goal-oriented. We do a full evaluation when you come in. So we really take the time to figure out the why. And that goes into everything what we do. We'll do the soft tissue work to release the muscles. We'll do the exercises, which we'll talk about today. And of course, my favorite, the chiropractic adjustment. All right, back over to you.
All right, let's hop to the next slide. So I actually think, Dr. Nick, you are, did you want to do a little overview about neck pain?
Oh, sure. So neck is incredibly important, and we realize this subconsciously, but over in the neck area is where a lot of our sensors are in the spine, especially towards the top. So pain in the neck can have a lot of debilitating effects. Headaches can start in the neck. Stiff shoulders can start in the neck. And even those of you that have ever experienced like the burning, tingling pain down the hands, that can also start in the neck. Proper neck comes from just knowing where your posture needs to improve and where the muscles need to relax. And that's what we'll cover today.
Great.
How's that for a very simple overview?
Perfect. So we are going to cover a handful of self-treatment options today. First, we'll cover some acupressure. Acupressure is used on specific points in the body that have a correlation to specific muscles to help open things up and tell the body that it's safe to relax and open up. Nick will be covering stretching, strengthening, and then some tools to help with both stretching and strengthening. And then we'll just do a brief discussion about heat, ice, and topical creams, all of which may be useful in your treating your neck pain arsenal. So that said, let's move on to the next one. So this is the guided treatment part of the session. I'm going to be introducing 5 or 6 different acupressure points to you and explaining a little bit about when to use each of these. So you'll be seeing a series of photographs with nice little kiddo silver, green, and red and gold stars on them. These are where the acupressure points are, but also where possible, I'll demonstrate on the screen, but the screen is a little hard to show you the back of my neck and the back of my shoulders, so I've got some other photographs coming up. So I wanted to let you know a little bit about acupressure first. Acupressure is something that you can do for yourself, or you can do it on other people. So if you're caring for a partner, or you're caring for children, or you're caring for your elders, you can apply acupressure to them just using your thumbs or a couple fingers and a moderate amount of pressure. The key with acupressure is going in there gently, actually, especially with something as tender as neck pain. And I'm sure, I have the feeling Dr. Nick would say the same thing. If you go in there with a lot of force and a lot of pressure, it can actually cause the muscles to tighten up more. So you want to ease in a little bit. This is not, I know there are a couple of people on this webinar who are the sort of more is better type, who are really willing to go for it and no pain, no gain. But for neck pain, you actually want to be pretty tender with it, especially with the acupressure.
Totally.
So great. So I will explain these first couple points. So when you look at your hand, if you make sort of a light fist, you don't have to be really clenchy, but if you make a light fist, as you can see on the photo, there are 2 points. One is between the pinky and the ring finger, and the other is between the third and the middle finger. The one on the left, the one between the pinky and the ring finger, is a point on a channel that connects with the back of the shoulder. So for those of you who suspect that you have some shoulder involvement with your neck pain, or you can actually feel that your shoulders are tight up here or between your shoulder blades in the back, this point is good for you. So the way you find it is you go from the knuckles and you just slide down until your finger falls into a little gully here. And that's the point you're going to use. Depending on the size of your fingers, if you have larger fingers, it's probably a little hard to get in there. You might want to use a small object or the back of a pen or something to get into this point. And the way you'll use it, again, not a crazy amount of pressure, just enough pressure to feel it. And you can either massage a little bit or you can press and hold. And while you're doing that, for this point and the next point, you can do a little bit of range of motion work. You can roll your shoulders back. You can roll your shoulders forward. You may want to try moving your neck around gently, gently, gently. So this point is great for opening up the shoulders. And you can use both sides. You can use both the right hand and the left hand to help open up both shoulders. So that's this point that's on the left between the pinky and the ring finger. And then the point that is between the middle finger and the index finger, similar situation where you go from the knuckles and you fall down into a little gully there. This point's name is actually stiff neck. So it's one of the premier points to use, and it's wonderful because while some of the points on the back of the neck and the shoulders may be a little hard to find on yourself, this one is very easy. So historically, this point was used with an acupuncture needle, but we can do acupressure as well. Similarly to last time, you may want to use a small object or the back of a pen to get into the point. Press again, mine is certainly pretty tender. I know I have a lot of neck tightness, so glad that Dr. Nick will be helping me open those up in a moment. But historically, this point was used by putting a needle or pressure in there and then doing range of motion exercises. So you will, when you're using this, we won't do a sort of full few minutes on it right now, but remember this point because it's a good point to use to do very gentle neck rolls. You can do some flexion down and back. Wherever in particular you're having trouble and constriction, you want to, while pressing this point, lightly stretch into that spot. And again, just to reiterate, this is not a no pain, no gain situation. With this, you want to be very gentle. And when you're stretching, as soon as you start to feel something pull, that's as far as you need to go. And you can just stay there or gently ease in and out of that spot. And again, we'll use both hands so you could press between the knuckles of the index and middle finger on the second hand as well. So remember this point. If there's any point that you remember throughout this talk, this is the one you want to remember. Feel free to put a dot of ink in there or take a picture of yourself pressing that point so you remember that this is the stiff neck point. And this will all help us loosen up so we can get into Dr. Nick's stretching exercises in a moment. Let's move to the next slide, Dr. Nick. So you may recognize the model in this picture. Apologies that it's not a little easier to show you these acupressure points, but hopefully the green stars in this picture will help. So this point, which again, it's the same point, but it's on both sides of the neck, is basically just under the hairline. And one way to find it is by, if you feel the top of your head and you move your hands down, you will feel that it's bony, 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 and then all of a sudden you'll fall off a ridge of bone into a fleshy area. And where you fall off that ridge into the flesh, that's basically the level where those two green stars are. And then in terms of how wide to go, you can see in the picture that they're about an inch, inch and a half away from the center line. Basically, if you start in the center of your neck, again, if you fall off that ridge, off the bony ridge, in the center of your neck, and then move sideways, you will basically cross a big thick tendon. You'll feel like your fingers go sort of up and then they fall into another little gully. That is your point when you fall into the other gully. So again, it's just off the bony ridge. And then in terms of width, you know, depending on the size of your neck, it's probably about an inch and a half away from the midline. This point is near the insertion point of the trapezius muscle, which is one of the main muscles governing the neck and the upper shoulders. So if we can get into this point, again, gently, not too hard, you may want to use your thumbs to massage the point. Another easier way that gives you a break on your shoulders, if you don't have a ton of shoulder strength or flexibility, is actually to lie down, and then your shoulders are supported. So if you lie down onto something flat and then put a finger or a thumb into these spots, you can activate them with a little bit more ease. And in this point, you're not necessarily doing range of motion. It's really just the gentle pressure there helps to open up the trapezius muscle, which again is guiding some of that tension likely in the back of your neck. So this is the first point. I will add that this point does also have a little bit of an emotional connection. We do use it in Chinese medicine also a bit for anxiety or emotional overwhelm. So if you have a combination of neck pain and anxiety and overwhelm, which also many of us have, this one is a good choice for you. Let's move to the next point. All right, we're going to get a little more complicated here. I'm trusting you can hang with me here. So you will see in this picture a red star and then two gold stars that are farther up. I want to help you find the red star first because we're going to continue to come back to this red star location. So we'll start there and we'll find the gold stars from it. And Skip, I know you mentioned earlier that you've got some neck pain. It looked like you were pointing right around here. So this point will be great for you in particular. So the red dot, the red star, is just below the vertebra that connects basically the neck to the back. And the way that you can find it, for most people, it's pretty easy. For some people, it's not. So let's hope that everyone on this webinar is one of the easier ones. When you move your hand down your neck and you get towards your back, you'll start to feel the vertebrae. They are these thicker wedges of bone that come at about inch spacing. And there's a big one that's at the section where your neck meets the back. Right below that is where the red star is. So if you're like most people, you have basically a big vertebra right there. And then if you were to move further south down your back, if your shoulder flexibility allows that, you'll notice that the vertebrae are smaller. So again, the red dot is just below that big vertebra that's at the junction of the neck and the back. Now, that said, everybody's body is built a little differently, and some people's muscles are so tight that their shoulders actually rise up, and it's a little harder to tell where that neck and back junction is. But if you can find that big bone at the back of at the base of the neck, that's where the red star is. So in order to find the gold stars, you're going to take 3 fingers and stack your 3 fingers above where your red star place is. And that's the level of the gold stars, where that top finger lands. So again, red star under the big vertebra, stack your 3 fingers on top of that, and that's the level where you'll find these gold stars. And again, on this one, you can see they're pretty close to the center line. So you might want to move just about ½ an inch away from the center of your neck. And again, this one is also a great one for lying down and sort of pressing up with your fingers. This one gets into the paraspinal muscles of the neck. So these are the smaller muscles that guide neck movement, help you keep your neck up. If you have a strange neck posture, which many of us do either on computer or during other times where we're taking care of things, these muscles are going to be involved. So at this point, again, you can lightly press or you can gently massage. All right, I think we have a couple more. Nick, do you want to go to the next slide for us? Great. All right, so we've got the same red star, but this time we're looking for the blue star. Now, depending on your shoulder flexibility, your arm flexibility, this point may be difficult to do on yourself. So it may be one to remember to use with a loved one if you have any aged loved one around who can help you out. If you do have the flexibility to do it on yourself, I'll show you where the point is. So again, we're going to find that big vertebra at the base of the neck, where the neck meets the back, right down at the bottom of that vertebra where there's a little dip. That's where the red star is. And then if you go one vertebra down further, again, this will be sort of an inch and a half. If you rub your fingers down your back, you'll feel you go over another bone and fall into another soft place. That's the level of the blue star. And then you'll travel out about 3 fingers width to hit that blue star. And the way you'll probably know is that if you move your finger over to about where that blue star is and press, holy moly, it's sore. At least for me, it's really sore. You will want to do this on both sides. This point is a little bit genius because it gets the connection between the shoulder blades and the neck. So many of us have a really tight spot on this particular pressure point. When Dr. Nick gets into teaching us about tools, I know one of the tools he's going to cover is use of a ball. And this is a great spot. If you are lying on the ground, to wedge a ball or a small round object on that point and just let your body weight relax into it. And that will really activate this point. It should open up the muscles, basically connecting that shoulder blade up into the neck, and should give you a good bit of relief. All right, we have one more, Dr. Nick.
Well, let's see it.
All right, this one is not so hard to find. You'll be relieved. So this point you find at the highest point of the shoulders in line with the nipple. So, you know, technically it's, oh, I'm gesturing at my screen here. It's halfway between the center of the neck and the shoulder bone, and that usually is about in line with the nipple. And it's just at the top of the shoulders. And I know for me, this area is really ropey and uncomfortable. Again, it's not no pain, no gain. So go slowly into there. You might want to use a little bit of a massaging pressure and let it do its work. So again, I've listed quite a few points here. You can see for yourself which feel like they're really opening things up. You may want to spend more time doing those particular points. Again, for all of these points, they're all in the fleshy part of your body. So on none of them should you be pressing into bone. If you feel like you're pressing something really hard, either your muscle's in spasm or you're actually pressing on bone. So if you feel like you're pressing on bone, you're not quite in the right spot, and you'll have to connect with me and we'll figure out how to get you the right spot. I do want to pause for a minute and take some questions if anyone has questions about finding these particular acupressure points before we move into Dr. Nick's piece.
I have a question.
All right.
For this last 2 points, are they both about symmetrical or one is a little more out?
Oh, the ones that are on the screen right now, they're supposed to be about symmetrical.
Okay.
Yeah.
I thought so. She has her shoulders just a little look uneven because of the dress, but
yes, either that or I need to come see you for a chiropractic evaluation, Dr. Nick.
I didn't even realize that was you. Okay.
That's me.
I have a question.
All right.
I was wondering if we can get this presentation sent to us so we can refer to it, because I feel like I'll remember it, but I might not.
But by tomorrow you won't. I know that's how it goes for me too. Yes, absolutely. We can send the slides out.
Mm-hmm.
Great. Thank you.
Sure.
We could even work on a hand down.
Yes. Totally.
All right.
Any other questions before we move into Dr. Nick's section? All right, Dr. Nick, it's all you.
Okay. Well, strap yourselves in because it's time to get into the nitty gritty. This was all relaxing, but it's time to really dig into those muscles. First thing people don't realize is that the tension in the neck doesn't always start in the neck. It could be our tight chest, our tight shoulders, all of those things you need to keep in mind as we're going to do these stretches. And the other thing is that what your shoulder does is probably the most important thing for your neck stretch. I'll keep emphasizing this and this will make more sense, but let's just start by switching over to me and taking a look. Hopefully everyone can see me now. Take your left hand, and if you're sitting, grab the bottom of the chair. So I'm just going around and grabbing the bottom of the chair, or if you're on something like a couch, just sit on your hand. This makes sure that our shoulder stays down for that whole stretch. And stretching can be nice. We'll talk about when to stretch after this, but let's just start by bringing our right hand or opposite hand to the opposite side of the head and slowly opening up all of this space. You're just guiding with the hand. All right. Now that you're here, let's play around with the angle. So let's look up into the ceiling a little bit. And this could make it feel tighter. If it does, great. This is your stretch. For some of you out there, you want to look down into your armpit. So let's just look down into the armpit here. And it's essentially the same stretch. You're trying to get your ear to your shoulder, but now we're giving it a little twist. Normally, when you look into your armpit, you're going to feel more of the stretch down the back of the neck. And when you look up into the ceiling, you're going to feel it all down the front. Now, we're going to go back to the slide because I want to do a little bit of talking. So feel free to either continue doing that stretch or just listen to me if you want a little break. Stretching isn't always the answer. We might wake up tight, and that's a great time to stretch. If you really feel stiffness in the morning, get some blood in there. There have been studies measuring the connection between the tone of the neck and what's called anterior head carriage. You can see me doing that on the screen right now. And your autonomics. That's just a fancy way of saying your nervous system and how it relates to the I'm really stressed. That's my autonomics in a sympathetic state. Or I'm completely relaxed on the beach. That's my parasympathetic state, the parasympathetic state. So releasing these muscles on its own can actually affect your mood. If that's what you're looking for some gentle, relaxing, opening up, then stick to stretching. That's your solution. Like Janet said, you want to be soft with the neck, you want to be gentle with the neck, but I know not all of you are like that. So we're going to go into the next slide, which is stretching with a little twist. Now, I have here my little tennis ball. I'm gonna keep it on the slide for now, but you can use anything. It can be a WD-40 can. That works. It can be a water bottle filled with water and then thrown in the freezer. That works even better. It can be a lacrosse ball if you are a pain addict. Yeah, but for the most part, a simple tennis ball will do. What happens is over the years, and you should see me on my camera again. Over the years, you will start to develop chronic tension in your neck. And you can't just stretch through that. You're going to end up stretching the point of least resistance, which means you're not achieving your goal of stretching the tightest bit. A good example is all of these neck muscles in the front. I want you to just either take your thumb for now if you don't have anything handy, or I'm going to use this tennis ball and go into the side of the neck and put on a moderate amount of pressure there and I want you to twist your thumb or whatever you're using and really just let that do all the work. You're just trying to introduce controlled chaos into the system. You're going in every direction. You're twisting it, you're bringing it up, you're pulling it down, you're bringing it to the front of the neck, you're pulling it behind the neck. And for a lot of you, that's just going to be the most effective way to get in there. If you do activities that strain your neck, like weightlifting, or just any kind of jiu-jitsu sport where you end up pushing with the neck a lot, these are just irreplaceable. You need to be able to get in there, and you need to send the blood straight into the neck. Janet mentioned the point on the shoulder back here, and just like that, you can put it on the ground and put your weight on it. They do make little stick-it balls, which look just like this, but with a stick-it side to the wall. And that's way more convenient because you get complete control over how much weight you put over the point, because it could be a hard thing to control when you're on the floor. The last but not least, for those of you that get headaches, I really recommend taking 2 tennis balls, either tying them together with tape or putting them in a sock and just rolling up the sock. It'll do the exact same thing. Just make sure you use a clean sock. And then bring it over the base of the skull, right where, I don't remember, it was the first or the second point that we talked about is.
That's
and
right.
You definitely want to put a lot of pressure over that. And that really helps with headaches. It can, even if it's a tension headache, which is a muscle-caused headache, it can just abort the headache on the spot. You got yourself a solution right there. Now, headaches happen for all sorts of reasons. It's beyond the scope of this webinar to cover it. So if you feel like yours is different, feel free to come see myself or Janet. But I want to go over the next slide, which is actually my favorite one. So let me share the screen one more time. And this one does have a picture that will help explain things a lot. So, strength heals stiffness. This is a total, teach a man how to fish moment. You want to create strength in the system if it constantly reverts to tightness. If you're one of those people that keep stretching and stretching and stretching, and it's been months of stretching and you still don't feel more flexible, whether it's the neck or even the hamstrings, you're doing the wrong thing. Just snap out of it. You need to be creating strength in the system. Now, for those of you that have pain at the base of the neck, this diagram is all you need. This is called upper cross. It's called upper cross because there is a cross pattern from front to back that is creating your pain. It's the most common thing out there as far as bad posture goes. That's all upper cross. That's our term for rolled forward shoulders and bad posture. Let's just read through it one at a time. Weak, deep neck flexors or inhibited neck flexors. And what that means is these muscles have grown too stretched over the course of the day. If your head is over here, this is actually getting really stretched out, and this point in the back is getting really tight. And here we go. Tight upper trapezius and levator scapula. Levator scapula is about that last neck point. Oh, the last before last. Shoulder point right here. So that's our typical pattern. These get weak, so these get strong, and then our pecs get strong, so our upper back muscles get weak. And who pays the price? It's that little spot at the base of the neck that's just handling a whole lot of force, a lot of force. Like, I can't emphasize that enough. Your head is a little bowling ball. 10 pounds. For every inch forward, you're doubling that weight. 20 pounds, 30 pounds, 40 pounds if you're really dedicated to the computer lifestyle. And that's just more pressure than a simple muscle can hold. All right, enough talking. Let's take a look at me. How do you reverse it? Let's do the most simple exercises out there. First one is chin tucks. I love this one. It's both, everyone with a headache gets this. Everyone with forward head posture gets this. And you don't want to have anyone see you do this because it's going to be a really unsightly double chin. But for those of you truly dedicated to feeling good, this is how you do it. Start here and then push your neck back like this, and then come back forward and come back and push your neck like this again. And if you're doing it right, you feel it in here and you feel also a little stretch in the back of the head, and that you know you're doing it right when that happens. Right, simple enough. When can you do this? In your car. That's the best one. If you have a headrest, you can just push into the headrest. Make sure your eyes aren't going down. This way you swerve off the road so you know you're doing it wrong. And you just push into the back of the headrest, see if you can hold it for a few seconds, and then you relax. And if you find yourself slowly creeping forward during long drives, this is also the solution for you. The other bit, I'm not going to demonstrate on here, but you really need to be aware of it. A stiff upper back could be causing both neck and shoulder issues. And this is the one we see the most in the clinic. This is the one people miss all the time. It doesn't make sense. It's the pain's here. Why should I be focusing on my upper back? Well, if your upper back isn't moving, then guess who's doing all the work? The next part of the spine, which is your neck. If you have a stiff upper back when golfing, then the twist in the mid back goes away. So you compensate with either a little neck thing there. Some people do a little shoulder thing there, or all the little hip compensations that people learn to avoid also comes from that. One segment just isn't doing its job, so the next segment has to pick up the work, eventually gets tired, and you start to develop pain. Cat cows. Does everyone know cat cows? It's a simple exercise from yoga. It'd be a bit difficult to demonstrate with this camera, but here you are. That's the cat. And God knows why, this is the cow. Just basically inch.
Oh, you're talking about bowing your back and then, yes,
And then
I know
arching.
the yoga pose.
And then dropping the chest. And that's a way simpler way to put it. So creating mobility in the back can actually relieve your neck pain almost immediately if that is the case. It's hard to tell whether you have a stiff back, but just have your partner just kind of push on your back. If it feels like a block of wood, you got yourself a problem. Okay, let's just go back to the slide real quick. So strengthening is important. Creating strength in the deep neck muscles as well as your back, which we didn't go over, but will create the proper posture that lets your neck just rest easy on the shoulders. If there's anything, you can walk away with from my bit of the talk, it's the strength matters. If you find yourself constantly coming back to stiffness and pain, just take a couple of weeks for a project of strengthening your neck, and this will just keep paying for years down the line. All right, that's about what I have.
Dr. Nick, can I ask a question?
Please, everybody.
So if you are using say one of the ball techniques, either the side of the neck or in the back of the shoulders, and you feel tingling or pain radiating, is that okay to proceed? Should you lighten up? Is that when people know that they should come in and make an appointment with you? Do you have guidance on that?
Yeah, try to stay reasonable. Too much of the tingling can mean that you're over a nerve or a vessel and you should switch around a little bit. But if you're getting shooting pain down your arms or your neck or your back, that's great. That means you found a good point. That's called the trigger point, and that's radiating down. Now, again, be reasonable. If you start to lose control of your bladder and other things happen, you're obviously putting too much pressure on that neck. But a shooting, radiating pain can sometimes mean that you're exactly on the right point and you should spend about 30 more seconds on it until the pain goes away.
Great. Helpful. Thank you.
Mm-hmm. Anyone else? Okay. So just a quick recap. Stretch by making sure your shoulders down, grab the seat, and bring and open up the neck space. Then if you're feeling more intense, grab one of the balls, work on your suboccipitals, work on the chest, but just get directly on the neck. You can't go wrong with that. And finally, if you keep doing these things and you're still coming back to where you were, it's time to start breaking out the strengthening routine, which is way easier than you may think. A lot of the strengthening will happen within the first month, and it has nothing to do with your muscles. It's just the nervous system learning to engage the muscles, and that's all you need. All
I
right.
just want to thank you guys for doing this webinar. I don't know, what do we call it? Zoom call?
Yeah.
Zoominar?
Zoominar.
Luminar.
Yeah, I really enjoyed it. I enjoyed seeing you, and I know a lot of people don't have their video on, so you feel like you're speaking to no one, but you're actually speaking to a lot of people. So thank you so much. I
Oh,
really
you're
enjoyed
welcome.
this.
Yeah, absolutely. And I just discovered I don't have my tennis balls here, but what I reminded myself of, I have those amazing little balls that I throw in the dryer instead of whatever, and they have the right consistency. So I've just been using them on my neck, and it's such a relief.
Great.
I need to probably make an appointment with you, Dr. Nick. I mean, Janet, I'm already a fan of Janet's, but I've never been to Nick's. So while you're talking, I'm here. So it's good I was not in video.
Good thing. We did, Dr. Nick, we did want to cover some ergonomic issues too, right? And a little bit about stress.
Yeah, just on that, Skip, I really appreciate you keeping your camera on. I don't think I could be able to do this if I didn't have some kind of facial expression to jump off.
I'm sorry about my hair.
Fab. Shelter in place hair. We love it.
Yeah, it's the COVID look. All right, so that was a bit ahead. Let's just stick to this slide and talk over ergonomics. Is that fine? Or
Sounds great.
okay, did you want to say something on the topic?
From my perspective, what I'm seeing in the clinic is two key reasons, and Dr. Nick, you may have more, but two key reasons that people's necks get out of whack. One is the slightly obvious, we're all in front of computers more working from home, or many of us are working from home, and our ergonomic setup is just not right. You may want to either take a selfie of yourself from the side to see what your posture actually is when you're in your computer setup. Is your neck really forward? Are you hunched over? Are your arms, bent at a 90-degree angle, or are they down or up, or is your mouse hand sideways? All of these things can have an impact. And Dr. Nick, I don't know if you have an ergo coach that you recommend, but that is one thing. And then the second piece is poor pillows. So some people have really wonky pillows. Either they're too loose or they're too firm and they're just not working. So if you're one of these people who actually feels okay at night and you wake up in the morning and you're like, oh, this is awful, you may want to try out some different pillows, see what you have in the house. I would used to recommend go to Bed and Bath and just try a whole bunch. These days, I don't know how many stores are open, so you may have to get a little creative or order some online that are returnable just so you can try out what works better for your neck. Dr. Nick, what are you seeing from an ergo perspective?
So exactly the same thing. I joked that there are two pandemics going on because everybody just transitioned to at homework instantly. They just took their kitchen table and they tried to do work there. It's all about where you keep your arms in relation to your body. I'm just going to stand up here for a bit, but you want the shoulders relaxed and the arms more or less on the same level as your elbow. If you have to go down for the mouse, you're going to end up elbow and wrist issues. Coming up here, you usually end up getting shoulder pain because you're just hiking up the shoulder to your ear to stay in line. So that's my quick and easy ergonomic advice. Unfortunately, we do not have anybody who does ergonomics currently, but pillows are also important. And the only thing I'd add to that is get the ones that have the neck rest. You can't go wrong with just having more of a curve. You don't have to take it to the same extreme as, I don't know if anyone's seen the traditional Japanese wooden pillows that just put wooden pressure on the neck to create that extension. But there are modern, comfortable equivalents, which I recommend. Any of them will really get the job done.
And Dr. Nick, you're talking about the kind of pillows where there's like a large piece and then it dips and then there's a smaller piece and it's a little bit firm so you get that ridge under your neck. That's what you're talking about?
Exactly. The outer edge is the firmer bit. That's what they all have in common. Sometimes they dip and they're a curve. Sometimes it's a regular pillow with just a blob with a rounder, thicker bottom, but they will all do the same thing with great success, which is create the neck curve.
Question. Can I ask a question?
Absolutely.
So this pillow that you're describing seems perfect when you're laying on your back, but a lot of us sleep on one side or exchange back with side. Do you have a pillow recommendation for that? Because I've been looking for a good pillow for years and I've never found something that really works well.
Can I take this one?
Please do.
Yeah, I'm a huge side sleeper and occasionally a belly sleeper. You just want one of those pillows that still have the rolled up edge, but it gets thicker on the sides, and that's what will get you through the side sleeping.
Can you show me a visual of that?
I'd have to send something out. I don't have a good resource for that right now.
Okay, it doesn't have to be right now, but if you can send me a visual so that I really can look for something that you recommend, I would be very appreciative. Thank you.
Yeah, gladly.
And then I guess before you move into the stress in the neck topic, Dr. Nick, if anybody on this call has worked with an ergonomic coach, feel free to drop their details into the chat. We are on the prowl for good ergonomic coaches to work with.
Always. Okay, so the Autonomics, has anyone heard of the Alexander method? Okay, what about the Feldenkrais method?
Yes.
Okay, so two very popular methods that were developed because posture impacts mood. Some of these, like Alexander, are directly geared towards making you a happier person, and it had the interesting backstory of just he was a vocalist and he lost his voice just overnight, and he realized that proper neck position just gave him his voice back, and the moment he reverted to what we call the anterior head carriage later on just would destroy him all over again. So it's just unquestionable that this space, our neck space, is just directly connected to our emotional self. It's coming from a yoga background. This is the one spot where we were always very careful to give tactile cues. You can't just go into a yoga class in certain places and just touch the back of the head. Too much abuse has happened, unfortunately, in this world that just kind of happens over here. So this isn't one of those great, like, oh, take home advice, but just a message to, yeah, nurture your neck. Yes. Don't feel like you're weird because your mood is dependent on how tight your neck muscles are. We're moving machines that learn how to think and feel to just basically move better and safer, and not the other way around. So give your neck a little care and love today.
That
That's
sounds
all I
great.
had for that. Yeah.
Yeah, I did want to spend just a moment talking about heat and ice and topicals. There is, sometimes there's a lot of debate about when it's appropriate to use heat versus ice. And I think Dr. Nick and I will agree that if you have what's known as an acute neck issue, which means that something recently happened, either you woke up and all of a sudden it was in spasm, or you just had some incident where you were golfing and you threw your neck out, something like that, that's a great time for ice because all the muscles are going to be inflamed in that area. I would say ice for at least the first day, maybe the first couple days. Otherwise, I tend to prefer heat, but that's my personal. What I recommend is that you try both. And you can do it in the shower. If you're in the shower and you have heat on the neck and the back of the shoulders, does that feel good and it feels like things are softening up? Great. Get a heating pad while you're watching TV, tuck the heating pad between the neck and the pillow and just soak up some of that heat. Conversely, if heat feels kind of icky and then you turn the shower to cold at the end and you're like, oh yeah, that really numbs out the pain, that feels great, good, use ice. If you're not sure, you can always trade off. So you can start with ice for 10-15 minutes, trade to heat for 10-15 minutes, back to ice, and alternate. Again, for those of you who either can work, if you're on conference calls and can sort of lie back into heat or ice, great. Or if you're doing TV or chill time in the end of the day, and that's a great time to apply heat and ice. I do also love some topicals. I think they can be helpful. I don't have any particular brands that I either represent or have any financial interest in, but I would say an over-the-counter like an Icy Hot or a Tiger Balm, the constituents in there tend to be very circulating, so you can actually get some relief because they bring the body's attention to that area and increase blood flow, so that can kind of help move things that are stuck. Here in my clinic, I know I have a couple different muscle patches where all the good ingredients are on this like sticky piece of paper that you can apply and leave on. It smells very menthol-y, but it really opens up the tissues. A lot of people ask me about CBD products. Again, I don't represent any, I don't have any favorites. However, anecdotally, I hear from people that CBD topically can really numb out the pain. And I think, Dr. Nick, do you guys recommend CBD products in your clinic?
Absolutely. There is
Okay.
some people who,
Janet and Nick, I just have to say, I love this so much. I have to drop off, and I didn't want to drop off without telling you how much I appreciate this and enjoyed being.
Oh.
thank
I
you.
didn't want to just leave meeting.
Mhm.
Well, thank you. Good to have you. Let us know how the neck pain improvement goes.
Yep.
Yes, and I loved all the stuff. I'm sure you could see me doing the,
Totally great.
thank you. I
Thank you.
appreciate doing this, and I will always log on whenever you do them. So thank you.
Thank you.
All right. See you around, Skip. Yeah, we definitely use CBD products. We use Aquova. I have a few people who just nothing they've tried works apart from CBD. And that's not altogether strange given how the inflammatory component can sometimes be even bigger than the physical muscle component.
That's right. And, you know, Dr. Nick, we didn't really talk about this, but there is often a lot of muscle memory in terms of where you hold yourself and how tight the muscles are. And part of certainly what you were talking about today is doing repeated work to help the muscles learn a different way of managing. Because if you do it once or twice and then forget to keep doing some of this acupressure, stretching, strengthening work, the body really remembers that tight space and it tends to go straight back into it. So using tools that will help decrease the inflammatory response and then doing this, all the work we've talked about today to help retrain the muscles can be really crucial.
Absolutely.
Great. Anything else on your topic list, Dr. Nick?
Yeah, something I just forgot to mention, but is important in the age of Zoom is be very mindful where your screen is and your camera is. I've already seen a few people with conference call cameras that are out to the side, and it might not seem like you're doing much by just changing your head a couple of degrees, but yeah, after a couple of weeks, you can develop debilitating neck pain from it. Having something right in front of you as a webcam can just be a problem solver in of itself. I've treated a patient for a whole month straight before we figured it out that it was the webcam. So
Very
be
smart.
mindful of that.
Okay. Wonderful.
Yeah.
Well, we have a few minutes left. I'd love to open it up again for any questions that anybody has.
Well, can you hear me?
We can. Hi, Alan.
How you doing? Basically, I had my screen up because I didn't want you to see me screaming in pain as I was doing the exercises earlier. This thing, oh my God. But you know what? Wow.
Yeah.
Really? I mean, just with the minimal amount from your demonstration, way better. And that's basically, I have no discipline at all. So in the course of the day, that's exactly what I should be doing virtually every day. But this is the first time I've done it in months. So the pain was phenomenal, but I can actually feel my neck glowing. You know how that glow you get when you get a massage?
Yeah.
Glowing.
Yep.
Oh, I love it. Yeah, absolutely. The more painful it is, the better it is for you.
Man, it hurt like hell at first. But, you know, I got to do it every day. Got to do it every day.
That's right. And you know what I actually recommend is setting an alarm on your phone and it says neck stretching and have it go off a couple, 3 times a day. So even if only one of those 3 times you actually get it done,
You know, that's
don't worry about it, but try to pick a couple times when you're not going to be out and about driving, whatever it is.
I'm going to do that. That's a great idea.
Yeah. Honestly, the whole car being just an easy trigger to do the neck exercises as well. I've noticed that the most challenging thing is getting into a routine for, especially for these little things that might not fit into the big picture that is your life.
Yeah.
But just having the same trigger every time, like, oh, I hear my computer starting up. Time to do this. Or, oh, I just got back home. I'm putting my jacket on my coat hanger. Oh, this is the 2 minutes to do this. Stuff like that will work way better.
Yeah, I'm definitely going to put in my phone every day. It's going to be an everyday beep. I'll hear it. Good idea.
Great.
Thank you.
Of course.
This was great. Thanks, folks.
You're so welcome.
Yeah, it was a pleasure doing this. I liked it.
Yeah, it's
thank you
fun.
so
It is
much.
fun.
Any other questions from anyone?
No, I just wanted to thank you very much. This is really, I'm feeling everything here, every single star and point, and probably the ones you didn't mention today are highlighting the arms, the whole thing. So I need to be doing a little more movement with my body. So right movement.
Yeah, good.
Thank you.
Right on. And feel free to stop by whenever.
Yes, absolutely.
All right, everybody, I got to run. Thank you very much.
Yeah, so do
We'll
I.
see you
but
all
thank you so
Tuesday.
much.
Same here, actually. So let's just round this off.
Bye-bye.
Great.
Bye.
Well, I wanted to, before, as we're closing and as people are dropping off, just remind you, if you do need more help, feel free to contact Nick or me at the details on the screen. And I do have a online health group where I'm posting events. Hopefully Dr. Nick and I will do some future collaborations for you all. So keep an eye on the meetup group, Bay Area Holistic Family Health. And I'm also posting the YouTube recordings to that group as well. I'll put the information in the chat for you and then we'll close it out.
All right. Taking advantage of the modern technology. That's great.
Indeed.
All right. See
True.
you all later.
All right.
Bye-bye.
Thanks, everyone. Thank you, Dr. Nick, for all your expertise. And
Yes, indeed.
until next time, we'll see you soon.
All right. Thank you, Janet, for making this happen.
You're welcome. Take care, everyone.
Bye-bye.
Bye.